Hello, everyone. Welcome to Women Talk. Today, we're going to be talking about all things brain health, including the effect of stress on the brain, normal signs of forgetfulness as we age, and ways to improve brain health and function. Brain health awareness has become such a healthcare priority and is an important part of healthy aging checklist. And I'm so honored to have Dr. Devi with us today. Dr. Devi is the Director of Neurology and a clinical professor of neurology and psychiatry at the Zucker School of Medicine at Hofstra Northwell and an attending physician at Lenox Hill Hospital in New York City. She's an expert in her field and has extensive experience and wisdom to share. With that, let's jump right in.
Hi, Beth.
Hi, Dr. Devi. Let me start by saying your interview this past fall on 60 Minutes discussing Tony Bennett's journey with Alzheimer's was extremely powerful and so insightful. As we've seen with our recent You and Your Brain webinar that we held this past June with Prevention Magazine and the Women's Alzheimer's Movement, it's so important to talk about brain health. And I've even heard some buzz around neurogenesis. Can you tell us what it is, and are there some ways that we can make our brains faster, fitter, and sharper? How do we build that better brain?
So neurogenesis actually means growth of brain cells. And contrary to popular opinion, yes, you can grow brain cells as you get older. And the easiest and fail-safe way to do that is aerobic exercise. 30 minutes of aerobic exercise a day will grow brain cells, not only generally in the brain, but also in the part of the brain that's very important for memory, which is called the hippocampus. Not a lot of cells, but enough cells. Also very important is that you can grow connections. And connections really are what makes the brain work, just like makes people also in human networks function. And brain networks rely on the presence of multiple synapses, which are junctions where nerve cells talk to each other, as well as multiple dendritic formations, which is basically nerve growth that allows the brain network to become more lush. So that can happen also at any age and helped a lot by social stimulation, intellectual stimulation, engagement, doing all the things that we really enjoy doing, and helping to keep our lives healthy by sleeping well, eating well, and preventing stress when possible.
Great. Who knew that aerobic, I'm thinking the Jane Fonda days, could make
I
us,
know.
right?
Yeah.
So let's talk about stress a little bit, because we know, living in 2022, everyone is you're not normal unless you're experiencing stress and anxiety. So we know that stress affects everything, including brain health. And we know that women are juggling so many things. How do we know if forgetfulness is normal, or is it a sign of something more serious?
It's a tough question, Beth, because we're all wired to forget. All of us forget from the time we were babies, and we will continue to forget into our old age. So forgetfulness is very normal, and forgetfulness is important for learning, and interestingly, also important for memory. So when we forget, what that allows us to do is it allows us to fall in love again. It allows us to forget about crawling and learn to walk. It allows us to forget about singing a tune out of tune and allows us to learn to sing it in tune. So forgetting is very, very important as an evolutionary mechanism to help us learn, to help us form new friendships, to get rid of old, perhaps, relationships that aren't good for us. So very, very important. Forgetting as we get older is also very common. We will forget names more often as we get older. We will have more trouble learning new things as we get older, particularly technology. Technology, it becomes more of a challenge as we get older. However, if our forgetting starts to interfere with our daily functioning, if we are forgetting our car keys so often that we're getting to work late fairly routinely, or we're having trouble paying our bills because we're forgetting to pay those bills, not just once or twice, but enough that we're having issues with it, then you want to start to worry about it and maybe have it checked out, because there are so many causes of forgetting that can actually be treated, and you can even cure that level of forgetfulness once you figure out the cause.
So good to know. And let's talk about caregivers. So if someone is a caregiver, how do we recognize, and this is, triggering the whole Tony Bennett interview that you did, because his wife spoke so eloquently about Tony's, decline. But if someone is a caregiver, how do we recognize if our loved one is exhibiting symptoms we should be concerned about? And if there is concern, what's that first step in getting someone some help?
So we're now talking about the kind of forgetfulness that could be associated with something like dementia, which is a progressive brain-related disease that causes cognitive changes, and that's related to nerve cell destruction. So Tony's wife, Susan, who I happen to know and love, as does everyone who knows her, is a real angel and is an incredible caregiver in terms of being there for him. She always says she's taking care of an American treasure, and that is her job. That is her job. But I also think it's tremendously moving, because there is a lot of, she's the reason he's able to do as well as he is doing and has done. So there is a tremendous onus on the caregiver to keep the person that they love functioning and being able to function. How do you recognize that the person has a problem? Sometimes it can be difficult. Sometimes the person is just more irritable or more angry. I just met with a friend yesterday who's a psychiatrist, and she told me that she went to visit her brother and his wife, and the wife was just extra nasty to her, extra mean. And she thought, this is unacceptable. So she left. She was visiting with them and she left. And a few months later, they found out that her sister-in-law was actually suffering from dementia. And the first symptoms were irritability and paranoia and an increased level of nastiness, if you will. So that's one of the changes. The person can have personality changes. They can be more depressed. They can be more irritable. They can be more forgetful than usual. They can deny that they're forgetting. And that can be a particular challenge. No, the problem is not with me. The problem is with you. You never told me that. But yes, I did. No, you didn't. That kind of thing. They can have trouble finding words. I had a patient that I just saw yesterday who's very, very functional, but she's noticed that she's having trouble figuring her way out when she gets out of the subway, which all of us sometimes will have that problem, but not if you've been coming out of the same subway station for several years. You should not have that problem. So if there's a change in functioning that's persistent, then you want to think about having that evaluated. And again, sometimes it's not a dementia. Sometimes it's something as simple as a thyroid problem or a medication that's causing the problem. Sometimes it can be pain, like a hip problem that can cause cognitive changes. So it's particularly important to figure out the cause, because one of the things that I think worries caregivers and sometimes even patients is that they're worried that if we figure out the cause and the cause has something to do with dementia, they're going to be put away in a nursing home. Yes. And I think that is a huge fear for patients. Mm-hmm. And that's one reason why they'll resist getting a diagnosis.
So let me ask you a quick question, because we hear dementia and you just did such a great job of explaining that, but I feel like it gets interchanged with Alzheimer's. So people are calling Alzheimer's disease like dementia. Can you explain the difference between Alzheimer's and dementia?
So dementia is the overarching category. So dementia is anybody who has a progressive neurologic, neurodegenerative disease that's causing cognitive changes. That's dementia. Okay. And there are many different subtypes of dementia. There is dementia that's because of the presence of plaques and tangles in the brain. That's Alzheimer's. There's dementia due to the presence of Lewy bodies in the brain, which is a kind of deposit, and that's called Lewy body dementia. That presents a little differently. There is dementia that's related to small silent strokes, which I actually see fairly often, and that's called vascular dementia. There is dementia from infections like mad cow disease. There is dementia from a bunch of different causes. The most common types of dementia are dementia from Alzheimer's, from vascular dementia, from a mixed dementia, from both Alzheimer's and vascular dementia, and Lewy body dementia. Those are the most common. And about 60 to 70% of dementias can be prevented by adopting lifestyle changes in your 30s, 40s, and 50s, by controlling risk factors, particularly for vascular risk factors that cause small strokes, silent strokes in the brain. You can prevent or delay the onset of dementia.
Such important information to have. Thank you for that. And, over the past 2 years, we've heard a lot about long COVID, and we've heard a lot about COVID brain fog. Can you tell us what this is and how we can recognize some of the symptoms?
So first of all, it's a new virus. So anytime our body's not been exposed to a new organism or a new virus, it's going to respond differently. And so with COVID, many patients have been experiencing slowed thinking, trouble finding words, a lot of fatigue. Fatigue is a big issue, and can actually drive the cognitive symptoms. Sometimes patients don't even want to get out of bed because they're so fatigued. The good news is that most cases of long COVID over time seem to get better. And patients do recover from their fatigue. A lot of times they get winded even just walking down the street. They will have slowness in thinking that gets better over time. But it does. The good news is most patients, in fact, nearly all the patients I've seen, have made progress and recovered over time.
That's such good news to hear, because I've heard some people saying that ever since getting COVID, that they just feel so tired. They don't have the same energy that they had pre. So it's good to know that there is light at the end of the tunnel and that you're seeing progress on that. So, I'm not going to let you go without asking a question about menopause. So how does menopause affect our brain?
Okay, and I will get to that in a minute, Beth, but just want to also say with long COVID, it's a symptom of our times that we think a year and a half and 2 years is way too long, right? Because COVID really came on the scene just a couple of years ago.
Right. Yeah, 2
right?
years.
And so we're just impatient. Here's this brand new organism that we've been assaulted with. And then yes, it's long COVID. Patients are getting better, but still just a little more patience, hard as that.
We're all the instant. Like we want to get the vaccine and we're done. Instant, I agree.
Go to sleep immediately, get up immediately, get your brain functioning. So we want that instant gratification, which it's very hard to apply in the real life setting. Yeah. So to get back to menopause, so I started with menopause and memory loss kind of in a roundabout way. I was on the faculty at Columbia, and we had a patient who was in her 50s, and she developed symptoms that looked exactly identical to Alzheimer's disease. She was having trouble remembering. She was from she ran a large estate in South America, and she was having trouble managing the estate. Her sons came in, and we all thought, my God, she has Alzheimer's. We even did a spinal tap on her. It was negative. But at that time, there was a study that said estrogen was helpful for women with Alzheimer's. So I put her on estrogen. And then lo and behold, 6 months later, she came in and she said, I'm better. I'm perfectly fine. And I said, of course, she's not that much better because she had Alzheimer's. But when we tested her, in fact, she had recovered most of her functioning. And so that got me thinking. And I then realized, based on all the research that was being done at the time, that there was this woman called Barbara Sherwin at McGill University in Canada who'd done a lot of research on women who'd had hysterectomies in their 40s, and they developed symptoms. They had trouble with their short-term memory. They had trouble finding words. They would say things like "sharpoo the campette" instead of shampoo the carpet. So they would just say all these things and not make sense. They had trouble with multitasking. They would be more irritable. They had mood changes. So subsequently, I did a study and found that 60% of women going through menopause have cognitive changes. And studies around the world have shown about that percentage. So cognitive changes are almost as common in women going through menopause as hot flashes are. However, we all know about hot flashes and night sweats with menopause,
Right.
but very few of us know about cognitive changes. So women in their 40s and 50s are freaking out. They think, oh my God, what is going on? I can't remember. I used to really be able to come up and speak at an event without even thinking about stuff. And now I'm sounding like an idiot. What's wrong with me? Do I have dementia? Am I, having issues? And the fact is, they may have something called menopause related cognitive impairment, which I wrote about and published in the Journal of the American College of Obstetrics and Gynecology. And it delineates all the different features that these are patients, women who are going through menopause, and perimenopause. So the period of up to 5-6 years before menopause, even when their periods have changed a little bit, but their blood levels may be normal of estrogen and their hormones, but they're having cognitive changes, and that they can be, you can find that when you do testing, they do have these changes. They're just not making this up. And there are many different ways to help. You can use hormones, you can use brain exercises, kind of physical therapy for the brain to strengthen up those areas. You can also use other medications. So there is help.
No, it's so great and so important to talk about, because I think especially women in their 40s and 50s, right? When you start feeling like you can't remember names and things, you're being forgetful, I think you want to pretend that it's okay. Like you don't want to share. And so, your message is, this could be a normal part of aging, but fitness, our beginning question when we talked about neurogenesis and the importance of aerobic exercise. So the importance of exercise, diet, and sleep are so important for our health and maintaining our brain health. And if you are experiencing some memory loss, or it's okay to talk to your healthcare provider to figure out what that is, what it could be, right?
Right. And the two takeaway important messages for me is make sure you sleep. Try to sleep at least once or twice a week without an alarm clock. Go to bed when you're tired, wake up when you're up, so try to do that at least once or twice a week.
Right.
And the other important thing is cut down on the amount of carbs and fats in your diet.
Right.
I think that's very helpful for the brain because it's also a good anti-inflammatory diet.
Perfect. So now we're going to take some questions from our audience. So Alzheimer's, I've got an audience from Tanya. Alzheimer's runs in my family. Should I be getting regular brain scans as I get older?
So it depends on the kind of Alzheimer's you have, Tanya. So if someone has Alzheimer's that begins, before the age of 65, then there's a 50% chance that the family member might get it, which is called early onset Alzheimer's. It's very, very rare. Less than 5% of all Alzheimer's cases are early onset Alzheimer's. Most cases of Alzheimer's are late onset Alzheimer's, which means it's multifactorial. It's related to diet, exercise, risk factors like heart disease and cholesterol and drinking and all of that. And so it's not really about brain scans, but making sure that you have a good, what's called a cognitive baseline, which you can get from, go to a geriatrician, neuropsychologist. They are the people who do the cognitive baselines, and make sure you are keeping all your risk factors in check.
Amber wrote in and she said, I've been hearing more about the gut-brain health connection. What are the healthiest foods, diets for my brain?
So that's a great question. I will tell you what I do. I try my best, much as I love croissants, and I absolutely am a huge fan of strawberry shortcake. I try to limit my intake of those wonderful dishes to once or twice a week. I try to eat a lot of protein, a lot of vegetables, and try to keep my carbohydrate and my fat intake to less than 60 grams a day of each. And doing that is very helpful for the brain. It's a good anti-inflammatory diet. It's also super good for arthritis and pain in the joints, which I have a little bit of off. And I can tell when I'm sinning with my diet that I start to get joint pains. And there's a lot of data about how it's helpful for cancer prevention, et cetera. So, yeah.
Great advice again. And so Natalie writes in, my mother was just diagnosed with Alzheimer's. What advice would you give, and what should our next step be?
I feel that people, our physicians particularly, are not as proactive about treating dementia as they could be, because there's a general feeling that once you have Alzheimer's, and what's the point? But as you saw, Beth, in the Tony Bennett interview on 60 Minutes, Tony was, I diagnosed him with Alzheimer's, but he still went on to sing. He's still been singing. He, at 95 years of age with Alzheimer's, had 2 standing ovations at sold out crowds at Radio City, which is never going to happen
with
to you or
Lady
me.
Gaga. No, I saw that.
With
and
Lady,
yeah.
So
yeah,
but we could have written him off and say, let's not. But the truth is, people can be very, very functional with Alzheimer's. So make sure that you put her on the right medications, that you have, that we control all her risk factors. If she has any stroke or vascular dementia, which 95% of patients with Alzheimer's will have some vascular risk factors, they need to be controlled. Make sure she gets a lot of physical exercise. There are lots of things you can do, just like you would with somebody who has any other chronic illness, like high blood pressure, for example.
That's great. And, with Susan taking care of Tony, she still had him like with the music, and singing and just doing the things that he normally did. Would you recommend, so with this, with Natalie's mom, if there's anything that she likes to do, would you continue to encourage her, whether it's even folding laundry, which some people find very therapeutic? Like, would you encourage her to continue like activities of daily living that she has always enjoyed?
Absolutely. I mean, when I get Alzheimer's, I know I definitely want to be able to walk my dogs every day, which I love doing. I love gardening, and I love hanging out with my family and friends. So I want to continue to do that. And that's stimulating for my brain at multiple levels. Now, if I never like Sudoku, I hate Sudoku, by the way, because I'm so bad at it. But I don't want then to be given Sudoku to play with, because it's a way of stimulating my brain, because that's only going to frustrate me. I'm very good with crossword puzzles, so give me more crossword puzzles.
Right.
But don't start, when I'm in my 80s and have Alzheimer's, don't start trying to teach me how to speak German, because I'm not good with languages, and it's only going to frustrate me.
Yeah, that's awesome. Thank you for that. So now we have 2 more questions, and so I'm waiting for those questions to come in from our audience.
I see one question from
there we are. Go ahead.
In terms of causes of forgetfulness other than dementia. So other causes of forgetfulness, medications. Medications are a huge cause of forgetfulness. Concussions can cause forgetfulness. Menopause and hormones, including thyroid hormones, can affect your thinking and cause problems. Autoimmune problems like lupus and multiple sclerosis can cause forgetfulness. Drinking. As any of us who've ever had too much to drink one night, the next morning we don't remember what's going on. That's a cause of forgetfulness. Stress is a big cause of forgetfulness. Any of us who's ever gone to an exam and forgot what to say because we're stressed, that's a big cause. Depression is a cause of forgetfulness. So multiple causes of forgetfulness, and you want to be able to check for them.
Good. Next question. I've read that healthy fats are good for the brain. Is that not true?
I'm, in a certain amount of fat. So I just say keep your fats below 60 grams a day, which is a significant amount of fat. So you wanted, for example, today for breakfast, I had a side of salmon, I had a side of greens, and a side of 2 poached eggs, right? So that's what I had for breakfast, along with a big bunch of coffee. But you can have some fats, you just don't want to overdo fats.
Moderation.
Yeah.
Right?
Sadly.
Moderation.
Yeah.
And is forgetfulness from consuming medication reversible?
Yes.
Oh, good. That's good to know. I think that's it. That's all for the questions for today. Dr. Devi, thank you so much for joining us today for Women Talk. And thank you to our audience for being such an attentive and engaged audience. Join us for our next episode of Women Talk on July 12th at 12 p.m. Women Talk, better sleep, better health. Thank you again.
Well, thanks for having me, Beth.
Thanks for joining us for another episode of Women Talk. Stay tuned for more Healthy Women live events at www.healthywomen.org. You can also follow us at Healthy Women on Facebook, Twitter, YouTube, or LinkedIn, or follow us on Instagram at HealthyWomen.org. We'll see you next time.